Medicinal marijuana and the preferences in cancer patients. Most people have had a family member or friend that has been affected by cancer. We asked some people on this subject. The questions that we asked were, what is your opinion on medicinal marijuana, and would you consider the use of it if you had cancer?
I believe that medicinal marijuana can be a very useful and helpful asset in the medical field. I think that it can help control nausea and other GI issues, and even some pain issues that are associated with some of those disease processes that are out there. That being said, I also believe that family members and other people that I know, I would feel that it would be an appropriate medication in using to help control some of those things. For myself, I personally would not use medicinal marijuana to combat certain diseases or disease processes, but I think that research should be increased in order to find good and helpful uses of medications such as medicinal marijuana to help control the onset of the disease process.
I think medical marijuana is one of the best drugs that we have available because there's no pharmaceutical companies behind that. It's a completely natural thing. Meaning there's not a lot of money motivating it, so I think it's a good start. And yes, I would use medical marijuana if I had cancer, and I would also allow my family members to use it. I would let them use it because of the lack of side effects and the positive things that it can do to help people with all the side effects of cancer. So,
okay, topic: medicinal marijuana. For like, if a member of my family had cancer, I think it can help a patient with their symptoms. I've seen it before. Now, would I take it if I had cancer? No, because I'm a recovering drug addict, and it would really mess with my serenity. And since you're taking it to improve your symptoms, it wouldn't do that for me. And so, for me personally, no, but should it be legal for patients? Yes.
I personally believe that medical marijuana can be a very good and powerful helping tool for someone, say, going through chemotherapy. If it can fight the nausea that's allowing them to eat, they can gain strength, they can fight cancer, might help them live and fight a disease that normally they would lose the battle for. So I'm all for medical marijuana in certain circumstances.
Medicinal marijuana is considered an illegal drug. In fact, the DEA states it is a Schedule I drug. It has been shown that it can be effective in helping nausea, vomiting, pain, while in chemotherapy treatments. Marijuana has been used for centuries as interest in medicinal properties. Recently, cannabinoids known as medicinal marijuana are being studied. There are many people that have political and ethical opinions, as we have shown. This presentation will go over clinical trials that we have shown medicinal marijuana to be helpful. Here are some key points. In this presentation, we will give clinical facts about the positive effects of medicinal marijuana in nausea, vomiting, pain, increased appetite, and insomnia. Let's start with nausea. The British Medical Journal conducted a trial whether medicinal marijuana versus anti-nausea medications worked on helping patients overcome nausea during chemotherapy. This trial proved to be positive, and most patients were able to go through chemotherapy without actually vomiting. Next is vomiting. The Cancer Journal for Clinicians performed a pilot study that found combinations of drugs with medicinal marijuana in a 24-hour period were more successful together than alone while having their chemotherapy, aiding them in a more relaxing session, giving the patient a satisfaction of not vomiting. Next is pain. In the Journal of Pain, a randomized, double-blind, placebo-controlled study was performed and found that chronic pain was just controlled with medicinal marijuana as an add-on therapy with pain medication, instead of just pain medication by themselves. As patients, this was a very successful trial since most patients were able to cut down the drug intakes of opioids. Fourth point is increased appetite. The analysts of internal medicine performed a trial test in which they found appetite stimulation was found to be more effective when smoking medicinal marijuana during chemotherapy. giving the patient the opportunity to gain weight and increase the intake of calories while their chemotherapy continued and not having the stress of losing weight. And lastly, insomnia. We can all identify with the lack of sleep, but in ill patients, they deal with it more often. In the Journal of Pain, a randomized double-blind controlled placebo study found that patients were already using medicinal marijuana with their chemotherapy treatment had a deeper, well-rested sleep versus longer periods and not rested sleep. These are our recommendations. The first point is Western medicine versus traditional medicine. When you are going through chemotherapy and having the option to choose the medications you want, you need to ask what the benefits of using medicinal marijuana are and what the side effects of chemotherapy cause, such as nausea, vomiting, decreased appetite, and insomnia. Second, open-mindedness. It has been told in our society that marijuana is wrong, but no one knows the positive impact that it has in cancer patients. Even though judgment is present, nobody knows how it feels to have cancer. Number 3, deciding for self. Having a trusting relationship with your doctor during your fight with cancer can be beneficial by allowing you to decide what is best for you and your treatment plan. Next is research needed. There's currently not much up-to-date research on medicinal marijuana. With more states having it become legal, there are pending research being done, which will hopefully show the positive effects of the alternative medicine. This concludes our presentation. I hope this has opened your eyes to medicinal marijuana in cancer patients and the benefits of cannabinoids. If you have any questions, you can email us at mis_a@msn.com or kmitre84@gmail.com. This information can also be available in Spanish if you desire. Thank you for taking the time to watch this presentation, and have a good day.